Pregnancy is a beautiful thing, and it's so spectacular, of course, when the mom gives birth to her baby. Then after a little while, you might start noticing, maybe I could lose these hips and get back to my weight pre-pregnancy, and there are ways to do that. If you are one of the moms that's looking to do that, today we have Dr. Jardine from Springhill Medical Center with us to tell us a little more about what to expect as far as after pregnancy and as you're pregnant, and a little bit about Medi Weight Loss Clinic of Mobile. Thanks for joining us.
Thank you for having me.
Okay, so first of all, we're going to talk about the weight gain during pregnancy. Is there a certain amount of weight that someone can gain? Does it matter?
Well, that's interesting you should ask. I brought with me an article today that comes from a journal of obstetrics and gynecology. It was published in November of 2010, and it's entitled Recommendations for Weight Gain During Pregnancy in the Context of the Obesity Epidemic. And the article goes on to cite the fact that 60% of women of childbearing age are currently considered overweight or obese. This is this obesity epidemic that we have. And it's felt that excessive weight gain during pregnancy is contributing to this. So there were recently some revisions to the amount that's recommended that's based on a woman's weight when she starts the pregnancy. For instance, someone such as yourself that would be considered normal or petite, we would suggest gaining 25 to 35 pounds to ensure adequate nutrition for the baby and allow for the placenta and the added increased blood volume and stuff during pregnancy. For a woman that started a pregnancy and is considered overweight, we'd now recommend 15 to 25 pounds. And for a woman that started a pregnancy considered obese, we would recommend between 11 and 20 pounds.
Wow, that's really interesting. Did not know that. I actually had a friend of mine come to me on Friday, and she said, Cherish, I went to the doctor, and she says that I've gained way too much weight to be 6 months pregnant. She's about my size. She's got a little belly on her. I didn't realize. I thought gaining weight was healthy for the baby.
It is, except that there are complications of excessive maternal weight gain or starting a pregnancy already obese.
Tell us about the complications.
Well, pregnancy-induced hypertension, diabetes, increased need for cesarean section, those would be some of the first things that come to mind. And during pregnancy, as an obstetrician, I would counsel patients all the time about don't gain too much, we've got to eat properly, and you have these myths that it's okay to eat ice cream because you're pregnant and you crave certain foods.
Not so much, huh?
You need to be eating healthy food and protein and brightly colored fruits and vegetables and not to excess. And
starting the baby out correctly.
Correct.
Exactly. Okay, so after you give birth, is there an amount of time that you need to wait and say, I need to start going to the gym, I need to start thinking about losing this weight?
Well, we encourage mothers to nurse after delivery. We do think that helps to lose the weight, and it also is helpful for the babies with proper nutrition to start their lives out. But once a woman's completed nursing and is 6 or 8 weeks postpartum, it certainly is probably time to get back to the gym, and that's where we can try to help them at our Medi Weight Clinic.
Right, and exactly how does that work for new moms?
Well, they would come see us, and we would talk about what their pre-pregnancy weight was, what a healthy weight would be to start another pregnancy, and we weigh them on a special scale that gives us a lean body mass and a fat mass, and we help prescribe a calorie intake. We encourage a high protein, low carb diet. We have some appetite suppressant medications and some injections that facilitate fat burning, and then we have them come back and weigh in weekly for the accountability factor of putting that effort in, both to go to the gym and stick to the recommended diet.
Okay, so there is a right way to do it. You obviously do have to eat when you're pregnant to nourish the baby. Make sure you're eating the right things. Make sure you stay within your weight limit that your doctor tells you to. Then when you're ready to lose it, start exercising, and you can also check out Medi Weight Loss Clinic. Absolutely. Okay, so you can get more information about that and Dr. Jardine and Springhill Medical Center on our website, Studio 10 tab on fox10tv.com. Thank you for sharing with us.
Thank you so much.